Hello, my name is Jeremy Bradley. I'm a Doncaster GP and Clinical Prescribing Lead for Doncaster Clinical Commissioning Group, the CCG. As many of you will know, the CCG recently took part in a consultation process across South Yorkshire and Bassetlaw with a wide range of patients, looking at how we implement national changes to what we prescribe in the future. In terms of spend on prescribed medicines that could be prescribed over the counter, Doncaster is one of the most expensive CCGs in the country. It's a huge amount and we need to address this. I would like to take a few moments to thank everyone that took part in the 569 million reasons survey. In Doncaster alone, 3,300 people did, the second highest CCG response across South Yorkshire and Bassetlaw. Your responses are extremely valuable and will help us to decide what next steps we take. We need to support patients as well as doctors, nurses and pharmacists to make sure these changes take place effectively. From the survey, you told us that in your view, doctors should stop prescribing these over-the-counter treatments. 82% of people said they would be willing to purchase something over the counter to treat a minor condition. You told us that with the right support, preferably face-to-face or online, 90% of you would feel confident about treating minor and self-limiting ailments yourself. You also told us that you were keen to free up NHS money for more serious conditions and treatment. Finally, from the consultation, we got a real sense that schools wanted items to be prescribed instead of purchased because they'd wanted a label with instructions. It would appear schools felt they were not able to administer medicines to children unless they are part of a prescription. As a result of your feedback, we have taken the following steps. We have prepared and given briefing packs to GP practices, pharmacists and schools to help them reduce the prescribing of over-the-counter products. We have made GP practices aware that most people support this move to stop prescribing over-the-counter medications. GPs and pharmacists can help you to arrange your minor ailments more effectively. Speak to your pharmacist if you think you might have a minor ailment. With several years of training, they are well placed to tell the difference between a minor ailment and one that requires more investigation. If you currently have an exemption certificate or a prepayment certificate, please consider this does not need to be used for obtaining over-the-counter medicines. Finally, please tell us if you have any issues or questions about our approach to reducing prescribing of over-the-counter medicines or if you would like further information. You can send any questions you have to doncasterccg.inquiries@nhs.net and we will get back to you as soon as possible. Thank you for taking the time to consider these important messages.